WINREVAIR is intended for use under the guidance of a healthcare professional. Patients and caregivers may administer WINREVAIR when considered appropriate and when they receive training and follow-up from the healthcare professional in how to reconstitute, prepare, measure, and inject WINREVAIR. Instructions for use. WINREVAIR sotatercept for injection for subcutaneous use. How to use your WINREVAIR injection kit for the package containing 2 vials. For subcutaneous injection only, inject just under your skin. In this video, you will find the following: important information for patients or caregivers. Before you start, get to know the parts of your kit. Important information you need to know before injecting WINREVAIR. Storing your injection kit. Get started. How to prepare and take WINREVAIR. How to throw away WINREVAIR. Frequently asked questions. Identify your kit. Please note that U.S. kits are shown here for demonstration purposes. Your kit will have minor labeling differences. One 90 mg kit containing 2 45 mg vials. One 120 mg kit containing 2 60 mg vials. WINREVAIR comes in 45 mg or 60 mg vials, packaged in kits. This video contains a demonstration using the 90 mg 2-vial kit, but you follow the same steps when using the 120 mg 2-vial kit. Important information for patients or caregivers. Before you prepare and inject WINREVAIR, you must receive training and follow-up from a healthcare professional. And you must be able to prepare and inject WINREVAIR on your own, as determined by a healthcare professional. Before you start, read the instructions for use booklet from start to finish before you start taking WINREVAIR and each time you get a refill. Ask your healthcare professional if there is any new information about WINREVAIR. Start with your healthcare professional. Do not use WINREVAIR until your healthcare professional has shown you or your caregiver how to prepare and inject it. Your healthcare professional should show you how to inject WINREVAIR before you use it. Your healthcare professional should also confirm at follow-up visits that you or your caregiver can prepare and inject WINREVAIR correctly. Questions? If you have questions about how to inject WINREVAIR at home or need more information, talk to your healthcare professional. Find the full product monograph that is prepared for healthcare professionals and includes this patient medication information by visiting the Health Canada website, www.canada.ca/en/health-products/drug-product-database.html, or the manufacturer's website, www.merck.ca, or by calling 1-800-567-2594. How to use WINREVAIR. Before injecting WINREVAIR, make sure you read the full instructions for use booklet to get the right dose of medicine. Mix medicine in Vial 1. Mix medicine in Vial 2. Combine medicine mixture from Vial 1 to Vial 2. Withdraw your prescribed dose from Vial 2, then inject your medicine. Watch the rest of this video for step-by-step directions. Get to know the parts of your kit. Top tray. Use the items in the top tray to mix the medicine. You'll find 2 vials of WINREVAIR medicine powder, 2 pre-filled syringes with sterile water to mix the medicine powder into liquid form, and 2 vial adapters to connect the vials and syringes. Bottom tray. Use the items in the bottom tray to inject the medicine. You'll find a needle for the injection and an empty dosing syringe to measure, withdraw, and inject your medicine. Important information you need to know before injecting WINREVAIR. You must mix WINREVAIR before using it. Make sure the medicine powder in the vial is completely dissolved when you inject. Prescribed dose. Your healthcare professional will tell you your prescribed dose amount in milliliters. Make sure to use this dose each time you use WINREVAIR. Your prescribed dose may change as you continue to use WINREVAIR. Use only the supplies that are in the kit to prepare your prescribed dose. Do not open the package or mix the medicine until you are ready to use it. Do not reuse any of the supplies. After your injection, throw away the used vials with any remaining WINREVAIR medicine, needle, and syringes in a disposal container. See pages 38 to 39 of the Instructions for Use booklet for more information. Storing your injection kit. Store the WINREVAIR injection kit in the refrigerator at 2 degrees Celsius to 8 degrees Celsius. Do not freeze it. Store your kit in the original container to help protect from light. Keep the injection kit out of reach and sight of children. Get started. Before you can prepare and inject WINREVAIR, you must first be trained and determined by a healthcare professional to be able to prepare and inject WINREVAIR on your own. Check the WINREVAIR product and expiration date. Remove the WINREVAIR injection kit from the refrigerator. Check the expiration date and look for any signs of damage on the kit or in the supplies. If it is expired or is damaged, do not use it. Call your pharmacy to get a new kit. Check that you have the medicine that your healthcare professional prescribed. Let your kit come to room temperature, gather supplies, and wash your hands. Wait 15 minutes to allow your kit to warm to room temperature. Cold medicine is more painful to inject. Along with your kit, gather these items and find a clean, flat surface where you will prepare and inject your dose. Please note that your disposal container may be a different color or size than the one shown in this video. Wash your hands with soap and water. Mix the powdered medicine into liquid form. Start with the top tray. Only use items from the top tray. Remove Vial 1, the pre-filled syringe 1, and the vial adapter 1 from the kit. Remove Vial 1, the pre-filled syringe 1, and the vial adapter 1 from the kit. You should also gather some new alcohol wipes, as you'll need them in the next steps. Check the medicine vial. Check the vial label to confirm the medicine is not expired. Inspect the medicine powder. It should be white to off-white and may look like a whole or fragmented cake. Do not use if it's expired, damaged, or you can see particles in it. Remove the plastic cap and clean the vial. Flip off the plastic cap and clean the rubber stopper on top of the vial with an alcohol wipe. Do not use it if the vial cap is missing. Do not touch the cleaned rubber stopper. Set the vial aside on a clean, flat surface. Align the vial adapter to the vial. Peel open the vial adapter package and remove the vial adapter from its package. Hold the blue neck of the vial adapter and align the vial adapter on top of the vial. Do not touch the inside of the vial adapter. To attach the vial adapter, hold the blue neck of the adapter. Do not hold the bottom of the adapter. Attach the vial adapter to the vial. Hold the vial with one hand, push down firmly so it snaps in place. You may feel some resistance. Clean the vial adapter. Clean the top of the vial adapter with a new alcohol wipe. Check the pre-filled syringe. Confirm the sterile water inside the pre-filled syringe is clear and the product is not expired. Do not use it if you see any clumps, particles, discoloration, or the product is expired. Snap off the pre-filled syringe white cap. Snap off the pre-filled syringe cap along the perforation. Do not touch the tip of the pre-filled syringe. Do not push the plunger. It may spill the water. Connect the pre-filled syringe to the vial adapter. Pick up the medicine vial with the vial adapter attached. Align the pre-filled syringe tip on the blue circle of the vial adapter. Push, then screw the pre-filled syringe clockwise onto the vial adapter until you cannot turn further. While twisting, be sure to hold on to the vial adapter. Do not push the plunger. It may spill the water. Transfer the sterile water from the pre-filled syringe to the vial. Slowly push the plunger all the way down to transfer all the sterile water into the vial. The plunger will move up. This is normal. Make sure all the sterile water is transferred to the vial. Leave the pre-filled syringe attached to the vial and set aside on a flat surface. Prepare Vial 2, pre-filled syringe 2, and vial adapter 2. Remove Vial 2, pre-filled syringe 2, and vial adapter 2 from set 2 in the kit. Important: repeat steps 4 to 9 to prepare Vial 2. Refer to page 13 in the Instructions for Use booklet or re-watch that portion of the video. Stop and check to make sure you have both Vial 1 and Vial 2 prepared. You need both vials prepared before you can continue the next step. Swirl to mix the medicine. Hold one pre-filled syringe in each hand and gently swirl both vials in a circular motion until the powder is fully dissolved. This may take up to 2 minutes. Do not shake the vials. When the medicine is mixed well, it should be clear. If not, repeat this step until it is clear. Press the plunger down to make sure all the liquid is in the vial. The plunger will move up. This is normal. Wait for bubbles in the vials to go away. Set both vials aside for bubbles to go away. This may take up to 3 minutes. It is okay to have slight foam around the edges of the vials. Before you continue, make sure the medicine in the vials is clear to slightly pearly and colorless to slightly brownish yellow, does not have clumps or powder, and does not have large bubbles. Prepare the vials by removing extra air. Start with either vial. With the vial standing upright, gently pull the plunger upwards to the top of the barrel, but be careful not to pull the plunger out of the syringe. Tip: this step only pulls extra air out of the vial to make sure you have the right dose. Important: perform this step for both vials. Stop and check you have both vials prepared before continuing. Remove the pre-filled syringes from the vials. Hold the vial adapters and unscrew both pre-filled syringes from the vials in a counterclockwise direction. Throw away both pre-filled syringes in the disposal container. You should have 2 vials of medicine prepared and ready to be used in the next steps. Combine the medicine from both vials. For the next steps, you will need mixed Vial 1 and Vial 2, along with the items from the bottom tray. Use items from the bottom tray. Clean the top of both vial adapters. With 2 alcohol wipes from the bottom tray, clean the top of the vial adapters. Use a new alcohol wipe for each vial adapter. Remove the empty dosing syringe from its package. Find the empty dosing syringe in the bottom tray and remove it from its package. You will use this dosing syringe to combine the medicine from both vials and measure out the medicine you need based on your prescribed dose. Do not touch tip of the dosing syringe. Pull air into the dosing syringe. You must do this to make sure the pressure in the vial is even and you get an accurate dose. Hold the dosing syringe upright and pull down the plunger to draw in 1.5 milliliters of air. Pull plunger until top rim of plunger is at 1.5 milliliters. Connect the dosing syringe to one of the vials. While holding the vial adapter, push then screw the dosing syringe in a clockwise direction onto the vial adapter until it stops. The dosing syringe should contain 1.5 milliliters of air. Push air into the vial, then flip the vial upside down. Push the plunger all the way down to transfer all the air into the vial. Then hold the plunger in place with your thumb and flip the vial upside down. Drain all the medicine from the first vial. With the vial and dosing syringe upside down, slowly pull the plunger back. Stop at 1.5 milliliters. This will make sure all the medicine from the vial is in the dosing syringe. Do not pull extra air into the syringe. Stop at 1.5 milliliters. Be careful not to pull the plunger out of the dosing syringe. Remove the first vial from the dosing syringe. Hold the vial adapter and unscrew the filled dosing syringe from the vial in a counterclockwise direction. Throw away the empty vial into the disposal container. Connect the dosing syringe to the second vial. While holding the vial adapter of the second vial, push then screw the partially filled dosing syringe in a clockwise direction onto the vial adapter until it stops. Do not touch the plunger. It may spill the medicine. Push all the medicine into the second vial, then flip the vial upside down. Slowly push the plunger all the way down to transfer all the medicine into the vial. This combines the medicine from both vials. Hold the plunger in place with your thumb and flip the vial upside down. Withdraw your prescribed dose. Pull the plunger back to withdraw your prescribed dose. With the vial and dosing syringe upside down, slowly pull the plunger back. Stop when you get to the amount in milliliters that matches your prescribed dose. The top rim of the plunger should line up with your prescribed dose. Tip: each line on the dosing syringe is 0.1 milliliters. Your healthcare professional will tell you your dose. It may also appear on the prescription label on your kit. Please check with your healthcare professional if you are unsure of your dose. Check for large air bubbles and air pockets. Check to see if there are large air bubbles or an air pocket in the syringe. You will remove extra air in the next steps. Remove air bubbles and air pockets from syringe. If you see large air bubbles or an air pocket, tap the side of the dosing syringe to move the air to the top. Slowly push the plunger up to remove extra air. You must remove large bubbles and air pockets to get an accurate dose. 1 or 2 small bubbles are okay. Compare the amount to the prescribed dose. After removing all extra air, compare the amount in your syringe to your prescribed dose. If you do not have your prescribed amount in your syringe, slowly pull the plunger back again to withdraw more medicine from the vial. Repeat steps 24 to 26 until you reach your prescribed dose and no large bubbles are visible. Confirm your prescribed dose. Before you continue, check to make sure you have the prescribed dose in the dosing syringe. The top rim of the plunger should line up with your prescribed dose. If the amount does not match your prescribed dose, repeat steps 24 to 27 in the Instructions for Use booklet, or you can re-watch that portion of the video. Remove the dosing syringe from the vial and set the dosing syringe aside. Hold the plunger in place with one hand. With the other hand, hold the vial adapter and unscrew the filled dosing syringe from the vial by turning in a counterclockwise direction. Throw away the used vial into the disposal container. Place the filled dosing syringe on a clean, flat surface. Do not touch the dosing syringe tip or let it touch any surfaces. It's recommended that you use the mixed medicine in the dosing syringe right after mixing, or no later than 4 hours after mixing. Attach the injection needle to the dosing syringe. Find the needle in the bottom tray and open its package. Do not touch the connection hub of the needle. With the needle still in the package, grip the base of the needle and twist on the dosing syringe in a clockwise direction until it stops. Remove the needle package. Do not uncap the needle. Move the safety shield away from the needle and toward the syringe. Place the dosing syringe on a clean, flat surface. Choose and clean your injection site. Select an injection site on your stomach, abdomen, or your upper thigh. If injecting on your stomach, avoid a 2-inch area around your belly button. Choose a different site every time you inject. Please note that the white areas here show possible sites where you could inject. Do not inject into skin that is damaged, sore, bruised, or has red patches. Do not inject through clothes. Clean the injection site with a new alcohol wipe. Do not touch the cleaned injection site again. Now, you are ready to inject the medicine. Inject your medicine. Pull the cap straight off the needle. Throw away the cap. Do not touch the plunger until ready to inject so you don't lose any medicine. Gently pinch and hold a fold of skin where you will inject. Insert the needle with a dart-like motion at a 45 to 90-degree angle. This helps you inject directly under the skin. Subcutaneous injection. Push the plunger with slow, steady pressure all the way down until the dosing syringe is empty. Confirm all the medicine has been injected. You can let go of the skin fold now. While keeping the plunger pushed in, remove the needle from your skin at the same angle you inserted it. Keep your fingers away from the needle at all times. To reapply the safety shield, push the shield against a flat surface until you hear a click. And see that the needle is covered. Throw away the dosing syringe and used items in a disposal container. Do not remove the needle from the dosing syringe. How to throw away WINREVAIR. Throw away any used vials, including any remaining WINREVAIR liquid, needle, vial and needle caps, and used syringes in a disposal container. This box should be provided to you by your pharmacist. Do not throw away the WINREVAIR vials, syringes, or needle in your household trash. Do not reuse any of the supplies. This product is disposable and should only be used one time. Important: always keep the disposal container out of reach of children. If you do not have a disposal container, you may use a household container that is made of a heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid without sharp objects being able to come out, is upright and stable during use, is leak-resistant, and is properly labeled to warn of hazardous waste inside the container. When your disposal container is almost full, you will need to follow your community guidelines for how to throw away your disposal container. There may be provincial or local laws about how you should throw away used needles, dosing syringes, and pre-filled syringes. For more information about the safe disposal of medical waste in your area, ask your pharmacist. Do not recycle your used disposal container. Frequently asked questions. What should I do if I am bleeding at the injection site? Place a cotton ball or a bandage on your skin right away and apply a small amount of pressure. If the bleeding does not stop, call a healthcare professional. Where can I find my prescription amount? Your prescription amount in milliliters is on your prescription label on your kit. Contact your healthcare professional if you cannot find your prescription amount. What should I do if I accidentally get some medicine on my skin or my work surface? Wash the area thoroughly with soap and water right away. What should I do if I am not sure I administered my prescribed dose correctly? Call a healthcare professional. What should I do if the plunger of my dosing syringe moves automatically when I try to withdraw medicine from the vial? Do not worry if your plunger moves slightly on its own when you are filling your dosing syringe with medicine. With one hand, hold the plunger in place to stop the plunger from moving. With the other hand, unscrew the vial from the dosing syringe. After unscrewed, it is safe to let go of the plunger. You can avoid this automatic plunger movement by pushing air into the vial before filling your dosing syringe with medicine. Refer to steps 17 to 28 for detailed instructions. What should I do if my kit parts are damaged or are discolored, cloudy, or have particles? Do not use your kit. Call your pharmacist to get a new kit. What should I do if my medicine does not turn clear after mixing and swirling? Do not use the medicine if you have swirled the medicine vial for about 2 minutes and let it stand for another 3 minutes, but your medicine vial remains cloudy or has clumps, powder, or foreign particles. Discuss with your healthcare professional. What should I do if the sterile water will not come out of the pre-filled syringe? Check that the vial adapter is attached to the vial securely. If not, hold the vial and press the vial adapter down firmly to make sure the vial adapter punctures the vial rubber stopper. What should I do if I dropped my kit components? Do not use them if any items are damaged. If you are unsure, contact your healthcare professional. Can I use my kit that has been left out of the refrigerator? Contact your healthcare professional or pharmacist if the unused injection kit has been out of the refrigerator for an extended period of time. Do I need to use the mixed medicine right away? We recommend you inject the mixed medicine right after mixing, but no later than 4 hours after mixing. If it has been more than 4 hours, throw away the medicine. If you have questions, please contact your healthcare professional. How can I get help preparing and giving my injection? If you have questions about how to give WINREVAIR the correct way or need more information, you can call your healthcare professional. If you want more information about WINREVAIR, talk to your healthcare professional. Find the full product monograph that is prepared for healthcare professionals and includes patient medication information by visiting the Health Canada website, https://www.canada.ca/health-services/drugs-health-product/database.html, or the manufacturer's website, www.merck.ca, or by calling 1-800-567-2594. Or you can visit www.winrevair.ca.